So hi everyone, my name is Chelsea Amo-Tweneboah. I'm a medicine resident at the Stony Brook University Hospital in Stony Brook, New York. I'm also a CardioNerds Academy intern representing the House of Tossing. I also have future hopes of pursuing a career in cardiology. I'm so excited to serve as the CardioNerds Conference Scholar for the Cleveland Clinic Aortic Conference taking place in gorgeous Cleveland, Ohio this year from September 23rd to September 24th. So thank you for having me.
Hello, everyone, and thank you for joining us today. My name is Rashmi. I'm a recently graduated cardiac surgeon from the University of Toronto and headed to Northwestern next year for an advanced heart failure fellowship. It is super exciting. I'm a newly anointed member of the CardioNerds ecosystem as a scholarship awardee for a podcast titled Surgeons on Scalpel, so stay tuned for that. However, today we will be discussing the extremely impactful 2023 Cleveland Clinic Aortic Conference. So it is our great pleasure today to be joined by Dr. Eric Roselli and Dr. Sagar Kalahasti. Dr. Roselli needs no introduction. He's the Chief of Adult Cardiac Surgery, Surgical Director, Director of Tall Rounds, Staff Surgeon at the Cleveland Clinic Department of Thoracic and Cardiovascular Surgery, and the Aortic Center Vice Chair. Dr. Roselli also holds an appointment at the Biomedical Engineering Department and is on faculty at the Cleveland Clinic Lerner College of Medicine. Welcome, Dr. Roselli.
Hi, Rashmi. Hi, Chelsea. Thanks for being here. We've participated with the CardioNerds team for several years, and I just love the way we embrace these opportunities to talk because I know I remember when Sagar and Dr. Kalahasti and I were residents together, and it seems like yesterday. And so,
we're not looking old at all.
Well, I'm not worried about it's more about how you act and how you feel than like, right, Sagar? But we remember very well being in your shoes, and in a minute you're going to be our colleagues and our peers, and so to have the opportunity to spend a little time talking together is really nice. I just love what you guys do with the CardioNerd stuff, and I love the CardioNerds name because I talk about it all the time with my partners. We're all running around working so hard, taking care of patients. And then like the funnest thing is when we bump into each other in the hallway and we'll be talking about like a patient or some heart thing that we ran into that was like so exciting and interesting. And the next thing you know, 2 or 3 other people, another guy, another gal pop in and they want to get in the conversation. And that's us like totally nerding out on hearts. I mean, we do it every day and it's really fun. And so, so thanks for bringing us together and giving us a chance to talk about the CLE Aortic Symposium. Is not only CLE for Cleveland, but it's CLE for Comprehensive, Lifelong, and Expeditious Care of the Aorta. We've, one thing we've learned is that, the aorta is a real organ and it requires attention. And when people are afflicted by diseases affecting the aorta, they really need that kind of, certainly in emergencies, expeditious care. That's how we often meet them. But they need that complete and lifelong care. And so that's kind of, one of the main ideas about this conference is to also try and be as complete as possible and comprehensive as possible when we talk about the education around this topic.
Thank you so much for being here, Dr. Roselli. I really appreciate it. And Dr. Sagar Kalahasti, thank you for being here as well. Dr. Kalahasti is the director of the Marfan Syndrome and Connective Tissue Disorder Center at the Cleveland Clinic. He's also a member of the aorta and a cardiologist at a section of cardiovascular imaging and the Robert and Suzanne Tillmich Department of Cardiovascular Medicine at the Sidell and Arnold Miller Family Heart, Vascular and Thoracic Institute at the Cleveland Clinic. So thank you for being here, Dr. Kalahasti.
Thank you so much, Chelsea, and thank you, Rashmi, for having us. Again, as Dr. Roselli mentioned, back in the days, when we started many, many years ago, we have kind of had a parallel track here. I was in internal medicine training and he was in general surgery. Then he went to cardiac surgery. Then I went to cardiology. And, during that time is when my interest in aortic diseases grew because, we're one of the largest centers that manage aortic disease patients. And, Dr. Roselli did more advanced training after he finished his cardiac surgery fellowship in endovascular and aortic diseases. So it's kind of interesting that how our tracks, came together, particularly with aortic disease patients. And now we work in cohesion with a lot of patients. And as he had mentioned, this symposium is a celebration of that, because he is on the front end of it, doing emergency surgeries in the middle of the night. He doesn't call me, thank God. But I'm on the other side of it, when these patients come to see me or one of my colleagues in cardiology for follow-up after surviving and going through this emergency surgery. Our goal is to kind of understand why this person got aortic dissection. Why did he suffer from aortic dissection? And that's where some of my focus has been, is to understand some of the genetic syndromes that leads to aortic dissection. But also there are a lot of other patients without known genetic diseases yet, or maybe I should say some of the mutations are yet to be discovered. In general, I feel all diseases of the aorta from a dissection standpoint, most of them are genetic. We just have not found them, the mutations that cause it. And so I think this symposium kind of encapsulates, starting from the acute care all the way to intermediate post-op management, education of the patient, and making sure that nothing like this happens to them in the future, and understanding not only their underlying etiologies, but also to educate their families, because I think that's a significant part of the management of these patients. So thank you so much for this opportunity.
Thank you.
Amazing. Perhaps we can get started on some questions that will maybe spark some discussion. Dr. Roselli, as you had mentioned, this conference is going to cover many exciting topics. It's going to cover all aspects of pathologies of the aorta, and it's going to bring together a multitude of experts, cardiologists, surgeons, but it's also going to include patients and other people who care for patients who are afflicted with aortic disease. And so we can see that it's a highly broad topic with different etiologies. Perhaps you can give us a sense of the global impact of aortic disease.
Yeah, well, gosh, I don't know if I can respond to the global impact, because there's so much of the globe is just really starting to scratch the surface with regards to kind of appreciating cardiovascular disease, but certainly in the developed world where, I suppose we have the luxury of really expensive and high-tech care. We're seeing aortic disease really becoming one of the most, most important sort of pathologies that we see. So I've always talked about the Cleveland Clinic as a place, certainly in the specialty of cardiovascular surgery, where it's like, what happens here is a barometer of what's happening in the specialty. We discovered angiography with Dr. Soames, and then we were doing coronary bypass surgery, and then we were a valve center before, other folks were really, we were predominantly a valve center over more than coronary disease before other folks sort of got to that sort of space. And what I've seen in my time there now is that nearly a quarter of the over 5,000 cardiovascular surgeries that we do in Cleveland involve the aorta. It's a huge number. We do 1,400 plus aortic operations a year. And it's just kind of grown steadily over the last couple of decades. If you look at some other sort of data to sort of answer that question about the impact, I think, we can look at bigger data. There was a paper from 20 years ago that Lars Svensson and Renee Rodriguez, where they looked at ICD-9 codes to try and estimate how many deaths could be attributable to aortic disease. And they suggested it could be as high as 40,000 deaths in the US a year are attributable to aortic disease. And then another study, I think it was Joe Bavaria that brought it to my attention, really interesting, was in a emergency medicine journal in Japan. They looked at, it was in one sort of precinct in Tokyo. They looked at all the sudden deaths that occurred in that area and did autopsies on all of them. And all of those autopsies included a CT scan. And guess how many they found were attributable to aortic dissection? 8%. That sounds like a lot, doesn't it? Like, just across the board, sudden deaths, 8% of them are aortic dissections. I think that's a really important disease, even though it gets pushed down into the top, 20 or something of causes of death. I bet it's a lot higher than that. So if we think about, close to 10% of sudden deaths being attributable to aortic disease, those numbers that Svensson and Rodriguez talked about, up to 40,000 deaths related to aortic disease is not a crazy estimate based on sort of their calculations. Plus, if we think about 2% of the population, or close to 2%, 1.7, 1.8% of the population at least, has bicuspid aortic valve disease, and close to half of those patients are prone to develop aortopathy. That's 1% of the population. My goodness, we're doing the right thing by giving the aorta some attention here, and we now have all these therapies, and, we're just learning a ton really fast, with improved imaging and, family screening. It's still sort of, surgical therapy for most of the things we see, but I think we're going to see, following this discovery knowledge that we're gaining, we're going to see medical treatments kind of come right behind all that.
Yes, thank you. I think that was so interesting. I think when it comes to heart disease, it's sort of something that people just want to deal with, as opposed to something like cancer, where people get so on edge and gather their whole tribe to come together for the management of it. So I agree that when it comes to heart disease, we should kind of push it to the forefront. And a conference like this is just doing just that, pushing these matters to people's minds. So thank you for that. So this was a question for Dr. Kalahasti. So Dr. Kalahasti, as you know, patients with aortic disease can be sick and have complex decisions to make. So who are the members of the heart team that need to be involved or should be involved to come together to take care of these challenging cases?
Yeah, thank you. So as Dr. Roselli had mentioned about the impact of the disease itself, I think imaging, has played a very big role in detection of the disease, with so much of CT scans for screening tests, whether it's a calcium score or a lung cancer screening, we're picking up more and more of the aortas at smaller sizes. So I think it's, even primary care physicians need to be part of that team to recognize that, when the aorta reaches a certain size, when to begin to refer to a specialist, right? It starts from there. And then, cardiologists should definitely be one of the first ones in that for initial assessment. And depending on the size at which they're diagnosed, they may need to go to surgery very soon, right? So cardiac surgeon with special interest, I would emphasize, with a special interest in aortic surgery. I think that definitely makes a significant difference. And I think, a large number, as I mentioned earlier, is underlying genetic diseases, right? So probably seeing a geneticist early on, that allows the message to be spread across the family members. I think that's very important. And then the other ones are, some of them may come after surgery too, like, if you're talking about, cardiac rehab kind of thing in the long term. So I think I probably would say the top members of the team would be a cardiologist, a cardiac surgeon, and a genetic counselor. I think that definitely would be. But I think from an awareness standpoint, I would say, primary care physicians, would be some of the ones, because they are the ones who are ordering a calcium screening, right? They are the ones who are ordering a lung cancer screening. So it's important to recognize when some, incidental findings are important to be followed up on, and when to refer, those patients to specialists in this disease.
Thank you
so much. So I guess, so to Dr. Roselli, or to both of you, I think we kind of touched on these topics, but, because we've seen a sudden growth in our knowledge in aortic disease. A lot of it is propelled by imaging. I remember, during residency, some of the vascular surgeons would say, for an open abdominal aortic aneurysm, they would measure it with their hands, they would measure the size of the pulsatile mass, and we've come a long way from there. We have seen heightened interest in open surgical repair. Endovascular repair is up in the forefront. Hybrid approaches, once again driven by imaging. Dr. Roselli mentioned this screening has changed. And now we also are talking about not only diameters, right? We're going outside of just aortic diameters. And there are people who are doing work on stress and strain and the dynamics of the aorta itself. So we're seeing this, this kind of exponential growth in what it is that we're learning about aortic disease. So Dr. Roselli, from your perspective, what are like the next steps? Like, what are the new frontiers that we, as someone like me, who's a recently graduated surgeon, like what am I excited to be seeing in the future?
Oh my gosh. I hope that like this conference opens your eyes in 1,000 different directions, right? So, the experiences we have in life, are the lens that we look through, and we have to look through those lenses in different perspectives. So, in this conference, we're going to hear from emergency medicine personnel and the frontier that they face. The number one missed or delayed fatal diagnosis, or serious potentially fatal diagnosis missed in emergency rooms, is aortic disease, right? So that's a frontier. The expanding the sort of aortic awareness to not just the lay public, but caregivers at the front line, to make sure that we're not like delaying emergency care. And then frontiers in, image sharing. That's all kind of simple logistic stuff, but still super important, and how we deliver the care and how we do that. And then you could go to the total opposite end of the spectrum and get sort of really esoteric and excited about things like how, we're going to take these patterns that Sagar and I see when we look at thousands of CAT scans a year, and we have these phone calls like, hey, I saw this lady and it looks a little funny to me. What do you think about it? Or what I call our RI. And we use those sort of pattern recognition as to create supervised machine learning algorithms to develop AI mechanisms to understand how we can make more sense of that imaging than just talking about a maximum diameter, right? So we'll be able to sort of do some volumetric analysis that looks at, not just maximum diameter, but length along the greater curve compared to the lesser curve in the curvature of the aorta to relate to risk. And then next steps, will be what we're doing in our lab. And your old friends from Toronto are all going to be here in Cleveland too. Yeah. Stuff like what Jennifer Chung and the team is doing there. And what we're doing in the biomechanics lab to try and understand how we can correlate other factors to help us predict risk in patients. So, we've identified some novel findings using mass spec of these specimens that we're hoping to develop a biomarker in our lab that might be useful in the decision-making process. We've got a plan to expand our 4D MRI, including an exercise bike on an MRI machine, so we can kind of get a better sense of how to understand the physiology of what's happening in the aorta and the physics of what's happening in the aorta and how it correlates with patients' risk. From that diagnostic end, I think there's a whole bunch of really cool stuff. And then, flip it around again to intervention. There's some really cool things happening with ways to maybe pre-treat an aorta, perhaps with some sort of ablative procedure or with a drug-eluting kind of bioabsorbable stent in the isthmus of the aorta to prevent late type B dissection in patients with perhaps a TGF-beta receptor 1 or 2 abnormality. I mean, there's things like that we can begin thinking about and exploring and studying that are, I think, at the frontier, and in a generation we'll see come into practice of what we do.
Super. Yeah, very, very cool. Thank you for that.
Mhm.
Thank you. Okay, so this could also be a question directed at both of you. So with this conference, like you said, it's important because heart disease needs to be at the forefront of what patients think about, since it's also a major killer of many patients that we see today. So what are your goals for both of you? What are your goals for the Cleveland Aortic Conference, or what will kind of make you come out of the conference thinking this is a job well done?
So I think the most important takeaway for me is like collaboration. We are having experts coming from multiple centers, sharing their expertise, and we are sharing our expertise. Like Dr. Roselli had mentioned about the frontiers, what the new frontiers are, what we are doing here, share it with the participants, and so they can take that message out there to raise more awareness. And we're also collaborating with some of the excellent work being done by the National Marfan Foundation, John Ritter Foundation, the aortic awareness group. So there's so much that is being done. And just like the CardioNerds, actually the social media awareness campaign has really taken off in the probably the last few years, where there is, and that I think is a wonderful collaboration and brings it more to the forefront and awareness. And again, we're discussing about some of the guidelines changing. So I was honored to be one of the writing committee members for the aortic disease guidelines. So, how did we come up to some of the decisions, in those guidelines, and how is that changing practice? To discuss those things and to hear from the actual, physicians and surgeons, how are they incorporating those in their daily care of these aortic patients? So there's so much that's going to be discussed, and sometimes I feel the time is too short, but unfortunately we all are short on time, so we have to pack a lot of information within the short span of time. So I'm really, really excited for this. And, we do this every 2 years, and is one of the highlights of my, of my presence in the Cleveland Clinic is to look forward to these experts who all are thinking, living and breathing aorta and aortic disease, so it's a wonderful opportunity.
I think my goal is that everybody that attends the meeting or part of the meeting walks away with a piece of knowledge that helps them save a life, and then tell somebody else about how they got to do that because they learned something that helped them save a life. That's why we're bringing everyone together. And yeah, we're talking about we're going to be talking about some crazy, novel imaging techniques that are, at the forefront. But we're also going to be talking about some really practical things, like, we've got our head rad tech talking about how he has a team available with all of the equipment and someone on call ready, so that when we have an acute type A dissection with, SMA malperfusion, how do we coordinate like this multidisciplinary team to get that patient from the helipad through our ICU triage unit, like stable enough to hit the OR, get them on pump and get their proximal aorta repaired and stent their SMA all at the same time with multiple teams coordinated, and do it any time of day, 24/7, 7 days a week. Those are real practical sort of discussions we're going to have, just as important as some of the esoteric sort of science we're going to talk about on the other end. And then, as Dr. Kalahasti already mentioned, we're also going to hear some of the other really important stuff that not only, helps people save lives, but make sure that lives are good. We're going to hear from patients and both survivors and families of patients about how we can be better for these people, to bring them a better life, from, getting the message out to how to deal with, PM&R kind of issues.
Yeah, I think that patient involvement and a patient perspective, I think is supremely important. And a lot of patients tell their friends and family to come to Cleveland Clinic because they have received excellent care, right? So it definitely goes a long way in not only raising awareness, but also making sure that the patients get the best care.
Yeah, patients bring us together. And I like what you said about collaboration too. Just, I got to throw it out there because I'm really excited about our faculty that we invited. A lot of times you see these meetings and we invite, you see people that are invited as faculty or big shots, and we got a bunch of big shots, but we were careful when we invited the teams that we didn't just invite someone who as an individual was a really great faculty have as part of this conference. We selected teams. So, the speakers you'll see are from centers where they work in a collaborative model with a cardiologist, a cardiac surgeon, a vascular surgeon, geneticist, a basic scientist or translational scientist. And some of those teams are even bringing some of their other folks along, like administrators and whatnot, to get a tour of the Cleveland Clinic. So, we want to share knowledge and help as many people as possible, as much as possible.
Yeah, that vascular surgery being part of the team, I think, is one of the major features of what we do at the Cleveland Clinic. It's a very, very important collaboration and seamless collaboration, right? That's the most important part. It's not like, oh, it's my territory, or it's beyond, this is yours and this is mine. It's nothing like that. It's like, how can we all together work towards, like going back to the Cleveland Clinic's slogan of patients first, so you put the patient in the center, and then how we all can optimize and get the best outcome for that particular patient. I think that's definitely I think aortic disease definitely teaches you that, and like I had mentioned previously in one of the other podcasts or something, it takes a village sometimes to manage these patients who come in acutely. And I think collaboration of these multiple teams is the key.
Amazing. Thank you so much. Thank you, Dr. Roselli and Dr. Kalahasti, for taking the time today. The excitement is palpable. For our audience, be sure to follow the CardioNerds Conference Scholars to keep up with key takeaways from your favorite conferences, but most importantly, the Cleveland Clinic Aortic Conference that's going to be held September 23rd and 24th in Cleveland, Ohio this year.